Hello, my name is Therese Lufer and I am here to just give you a little information about the Graduate Certificate in Dermatology program here in Dublin City University. And just to note before I start, my contact details are there on the screen and also a common email for the faculty office if you have any questions or queries about the program after this presentation. Okay, so who is the program aimed at? It's aimed at nurses and midwives working in either acute hospital or community settings and who encounter people presenting with skin conditions, including those requiring minor surgical skin procedures. The program itself is delivered by a host of leading experts in the field of dermatology, including registered advanced nurse practitioners, consultant dermatologists, specialist registrars, and in both dermatology and plastics and a host of other personnel that feed into the program. A program outline. The program comprises of 3 10-credit modules. So those modules are all at level 9, which is master's level. You would undertake 2 core modules that you have to do, and then you have a choice of option modules from which you would select 1 option module. So 3 modules in total. And the program is delivered on a part-time basis over 1 academic year. We have 2 semesters. Semester 1 is in autumn and semester 2 is in spring. And you can find out further information about the dates of when semesters tend to start on the academic calendar in DCU, but we would furnish you with particular dates of the modules going forward. The program itself is delivered using a blended learning approach. So face-to-face teaching in DCU is combined with online learning activities, and each module requires 4 days of face-to-face teaching in DCU where you would be required to attend. 2 of the modules combine these days into blocks of 2 days and 2 days. So that gives a good kind of amount of flexibility for people who are working full-time, as most of the people who sign up for the course are. And also it allows, good flexibility for people who are traveling from a distance. Particularly we tend to attract people from very wide and distant areas in Ireland. So we also record our sessions and make them available on the virtual learning environment for students that we use in DCU. It's called Loop, but that doesn't replace face-to-face requirements on the program. So, the program has 2 pathways in its structure, and what pathway that you would choose would be determined by you really and your work setting and what your typical clientele that you would come into contact with are. Pathway 1 targets those who are in the dermatology setting full-time. So maybe would work in hospital-based dermatology with dermatology clients the whole time. But it is not limited to people working exclusively with dermatology patients the whole time. But that particularly would be, that pathway is particularly suited to them, where it would offer 3 specialist clinically focused modules in dermatology and provides those with a special interest in dermatology the ability to progress their careers and competencies towards maybe advanced roles within the dermatology field. Pathway 2 then is a little bit more, would encompass people coming from a broader spectrum of clinical areas, particularly maybe nurses working in roles such as maybe GP practice, surgeries, public health nurses, community nurses, among others, minor injury units in casualty maybe. So you're not necessarily dealing exclusively with dermatology clients, but that you would encounter dermatology clients in your natural working practice. And all of those clients that you would deal with, who present with skin conditions, that you may be undertaking the need for undertaking minor surgical skin procedures with them, such as, for example, maybe your clients might require cryosurgery, or maybe some wound debridement if you're working with clients in maybe the community who had leg ulcers, things like that. Lesion identification, local anesthetic administration for some procedures if you're suturing, abscess, cyst management, punch biopsies and curettage, depending on what your role is, what you tend to do on a daily basis. But doing that pathway will provide you with the opportunity to build on your practice towards maybe advanced roles in whatever area that you're particularly working in. The program modules, as I mentioned earlier, you have core modules, 2 of which you're required to do. Then you have a choice of an option module from a choice of 2 on the right-hand side of the screen there. So just looking at the core modules on the left-hand side here. The first module you would do in the autumn semester, and that's chronic skin conditions. And this module would focus on commonly occurring chronic dermatological conditions, such as eczema, psoriasis. It also includes things like genetics, epidemiology, pathophysiology, clinical features, diagnosis, management and treatment of a variety of chronic skin conditions. There's also focus on psychological aspects of living with chronic skin conditions in that module as well. The module beneath that is done in the spring semester, and that's surgical skills for healthcare practitioners. And this provides candidates with the opportunity to develop and consolidate minor surgical skills capability. For example, like I mentioned in the previous slide, maybe cryosurgery or wound debridement, lesion identification, local anesthetic administration, suturing, punch biopsies and curettage, abscess and cyst management. Now, you mightn't be doing all of these things at all, but you might be doing maybe 1 or 2 of them, and that's why this module is a core module, and this is why you would need to be working in an area where you would encounter the need to do minor surgical skin procedures, because this is a core module. The option modules then, the first one is delivered in semester 1, which is the autumn semester, and that's dermatology treatments and therapies. So this is quite a specialist module for those, I suppose, working with dermatology clients, requiring maybe specialist topical and or systemic treatments and therapies, such as maybe biologics, antibiotics, phototherapy and other systemic treatments. Management of skin cancers and other skin, hair and nail disorders are also considered. So you would make a decision yourself, really, if you felt that that was a module that you think you would benefit from, depending on where you're working. The other option module that is available is advancing evidence-based practice. So this is a module where you would focus on an aspect of dermatology practice, and we would equip you with the knowledge and skills and the capability to use the process of evidence-based practice. So the key steps that are involved in the evidence-based practice process, and apply them to the field of dermatology and a particular dermatological aspect, and you can move forward with that in your in the module and the assessment piece for the module, for example. The program assessment approaches include case studies, multiple choice questionnaires, maybe poster presentation, reflective practice, and also competency-based skills assessment. So you would have some assessments to do within your own clinical setting, and they would be supervised by your clinical supervisor that you will be having in place to support your learning on the program. Now, there is no written examination in the program. The modules are all assessed using continuous assessment, but you would have your competency-based assessment, and that would include one in DCU for one of the modules. The program requirements are all listed on the DCU website, but I would just wanted to draw your attention to these 3 in particular. Firstly, as I have mentioned on a previous slide, candidates must be working in an area where they're likely to encounter the need to undertake minor surgical skin procedures. So those procedures that I have listed in a previous slide. So you need to be encountering the need to undertake one or at least one of those procedures. To fulfill the assessment criteria for the module, there are very clear criteria, and unless you're encountering these kind of clients, you wouldn't be able to fulfill the assessment load. But if you have any queries in relation to your eligibility and suitability, please make contact with us and we'll clarify that very quickly for you. The second requirement would include that you must have an identified clinical supervisor or a line manager or somebody who can attest to the fact that the learning opportunities may present themselves to you during the course of your program. And in doing so, these supervisors would sign an engagement agreement for clinical supervision process form for you in advance of commencing the program. And this is included in the application process. So it's just to ensure that your learning opportunities are made available to you when you are on the program. The other thing I just wanted to draw attention to is that all the modules, all the 3 modules on the program are available to undertake as a standalone basis. And we do typically get clients signing up for individual modules that are run as part of the program. And you can do that too if you didn't want to do the program. But what we tend to find is people who might do one of the modules would then decide, actually, I'm going to sign up and do the program in the subsequent year, perhaps, depending on what suited them. You are allowed to do that, but you can't do them all 3 modules individually on a standalone basis and then come back to DCU, for example, maybe a while later and say, oh, I did all 3 modules on a standalone basis. Can you now give me a graduate certificate award? That wouldn't be possible. You can't look for it retrospectively. And full details are given on the website as well. But as well, if you have successfully completed one or more of the modules on a standalone basis and you then wish to sign up and apply to undertake the graduate certificate program, you would be eligible to have exemptions against any successfully completed modules done previously. And the cost of your program would be obviously adjusted accordingly. So just wanted to highlight that. So if you have any further information about the program, please log on to that website. The actual application code for the program is DC741. So, and like I mentioned at the start, if you have any questions or queries about your eligibility or suitability, or want anything further about the modules, just please get in touch with us, or else look at the website where you'll find detailed information about each of the modules. It will be there on the website. And closer to the start of the academic year, we will have dates available on when the modules will roll out, but that wouldn't be available until closer to the start of the semester. Okay, thanks very much for listening.